Hey everybody, this is Dr. Shirmo, otherwise known as Dr. Shir Muhammad, coming to you from Trinity Family Physicians. Just wanted to talk to you for a minute, a little bit about this COVID-19 and what's been going on in our country and in our society closer to home in Trinity, Florida. I know there's a lot of people that are scared. There's a lot of people that have a lot of anxiety, and people are just wondering, what can I do? What should I do? What am I doing that's dangerous and wreaking havoc and causing issues for other people by passing on this virus potentially? Or what am I doing that's safe and that I should continue to do? Should I be wearing masks? Should I not be wearing masks? Should I be wearing gloves? Should I not be wearing gloves? I'd like to talk to you all a little bit about that today. And if you do like it, please post that you like it on our Facebook page for Trinity Family Physicians. Write us a review. We love that. And please like this YouTube feed as well, and let us know what you want to hear more about, and we'll be happy to do that. So let me first start talking about COVID-19. I hope you guys have been watching the news, and by now you understand that this is a virus. It can live on surfaces for a period of time. It can live on your shirt. It can live on your hands. Okay, it can live on plastic bags. And depending on the surface that it's on, it has a different lifespan. So in other words, on a plastic bag, it will live longer than it would on a paper bag, just because of how the virus is and the product that it's on, how breathable it is, okay? These things are important to understand and to realize. I don't want to get into the details of that. That's very available by just Googling it. What I want to get into is, what are you doing, and is it safe or is it dangerous for yourself, for your loved ones, and for the community at large? So let's take on the face mask debate. It's a big debate right now. Should I wear one? Should I not wear one? And am I protecting myself? Am I protecting other people? Okay, folks, if you have a fever, if you have a cough, if you have a sore throat, if you think you're getting sick and you have symptoms, please, please, please wear a mask. Please do so. Limit your exposure to other people. I hope by now everybody understands that. If you have a virus inside of your body, if you are getting sick, it may be COVID-19. It may not be, but you don't want to take that chance and pass it on to loved ones or to other people, because if you do, it will continue to spread, and we don't want that. So wear a mask, wash your hands, keep yourself away from other people, isolate yourself as much as you can until the virus passes. And certainly you're going to have questions. You want to get in contact with your primary care physician. Hopefully that's us at Trinity Family Physicians right away. We can set you up for a televisit. I don't want you to come into our office. I don't want you to go into urgent care or the emergency room. I want you to call our office and let our lovely people that are answering the phones help you. Okay? They're going to answer your questions. They're going to get you scheduled for an appointment, all right? And we're going to take care of you over the phone, through your computer, through your smart device, whatever we've got to do to give you the care that you need and your loved ones need, okay? To get you better and to prevent this thing from spreading. That's number one. Number two is the fact that, let's say you don't have any symptoms. You're not sick, okay? But you're going to the grocery store. You're going to, anywhere where you need essential supplies, and you know you're going to be around people, and you accidentally run into people when you go down aisles. Oh my gosh, it's, the aisle is narrow and I'm within a couple feet of them. Okay, that's fine. Walk by them briskly, quickly, look away, and keep moving. Okay, that's number one. Number two is the fact that if you are at high risk for an infection, or if you're at high risk for having bad things happen to you because you have other problems like asthma, okay, or COPD, okay, because you smoke and you've smoked for a long period of time. If you've got any kind of lung problems, if you have heart problems, if you have kidney problems, if you have diabetes, if you have a lot of medical problems, okay, or your providers, your doctors have told you that you're at high risk for COVID-19, or you think you might be, all right, wear a mask. Yes, it's okay for you to wear one. We don't want you to get this. We don't want someone to walk by you, cough in your face, okay, and have you pick up this virus, for this to go into your eyes or in your nasal passages or through your mouth into your lungs, and for this thing to replicate and continue to grow and get you sick. We don't want that. I want you to wear a mask, okay? Make no mistake about it, all right? The other thing is gloves. Should I wear gloves? Folks, if you wash your hands and if you don't touch your face, okay, there's no reason to have to wear gloves. The only people that should be wearing gloves are people that know, or they're going to be in an environment with sick people. They're going to be touching something that they don't want to touch, okay? It does serve as a barrier. The moment you take those gloves off, you should still wash your hands again. What I am seeing is I'm seeing people go into stores. I'm seeing them go into grocery stores. I'm seeing them go into public places with gloves on. They're touching everything that's dirty that could potentially have the virus. And then what do they do with those gloves? They touch their face. They touch their clothes. They touch their cell phone. And guess what? The moment they take their gloves off, they're touching their clothes, they're touching their cell phone, they're touching all those things that have been contaminated with the virus, okay? That doesn't work. We don't all need to wear gloves. Leave that for the people that need it, okay? Our healthcare professionals, all right? That's number 2, okay? So we talked about the mask, we talked about the gloves. Now let's talk about gowns and these protective clothing that we can have. If you are not working in a healthcare environment, you do not need protective clothing, all right? That's it. Okay, if you have someone that's sick in your home, or if you go somewhere and you think you've come in contact with people that are sick, or you think the germs are on your clothes, the moment you get home, take those clothes off, put them in the washing machine, and wash them in the highest temperature possible for that clothing that's safe for them to be washed. That will get rid of the virus. Soap and water will get rid of the virus off clothing, okay? All right, I hope this video helps. This video was to talk to you guys a little bit about the masks, okay? It was to talk to you about gloves, all right? And it was to talk to you about clothing. Stay tuned to the next video, because in the next video, we're gonna talk about, is it important for you to go to your doctor during this time period? Is it safe to go to your doctor's office? And I've got great news for you, especially for all those people that are patients of ours at Trinity Family Physicians. I'm going to tell you what we're doing, what we've been doing that's been different than what a lot of different offices have been doing, okay? And what makes us unique. And I think a lot of doctors' offices are smart enough that they are doing this as well. We're seeing it. I've been talking to people. I've been calling other doctors in the community, other specialists, primary care doctors, and they're all trying to do the right thing. But the one difference between our practice and other practices is this, is that we trust our patients, we give guidance to our patients, and our patients follow our recommendations. And how does that affect you? How does it affect you that another one of our patients follows our guidelines? It affects you at days like this, because our patients know not to come to the office if they have the symptoms that we've been hearing about, the fever and the cough. They respect our rules and the regulations that our society has, and they're calling us. So a big shout out goes to our patients. We love you guys, okay? And number 2 is for those people that don't have a primary care doctor. We'd love to have you part of our practice. Our providers are great, but our patients are great, and you'll be sharing our waiting rooms with those people down the road, okay? And right now, those sick people are staying out of our waiting rooms, and we're taking them through televisits, all right? And we hope we can do the same for you and your loved ones. God bless, and stay tuned for the next YouTube video. Have a great day. Thanks. Bye-bye.